I think we got a lot of invocation to action. I love it. Now we're going to hear from people who are actually doing the work. Before even any introductions, these are the people doing the work. The reason we have this amazing panel put together is because not only are people doing the work, they're actually using data and storytelling together in the forms of a number of different tools that are being used for both advocacy purposes, for explaining and communicating with our constituents, other residents, what the potential issues are and how they might be ameliorated using through action, different activities that King County Metro, Front and Center is doing, as well as Washington State DOT. And so on today's panel are these three different organizations representing what they're doing through the community and through some of the data and data advocacy that's been happening in order to explain to people what some of the equity issues are, what some of the active transportation issues are, and how we might ameliorate it, and being able to metricize how we're making progress along those lines. So I'll ask each participant to introduce themselves, but I'll just say that we have Nick Abel speaking first. And I'm gonna put your slide deck up.
Thank you, Anat. As Anat said, my name's Nick Abel. I use he, him pronouns, and I'm a program manager at King County Metro. I manage all of our agency's contributions to Health Through Housing, which is a portfolio of permanent and emergency supportive housing sites throughout King County. If you want to go to the next slide, there's a little more information about that. So Health Through Housing was actually initially a response to COVID and was a means of social distancing in emergency shelters. At that time, a lot of hotels and apartment complexes were available very affordably throughout the region because there were not a lot of people traveling and staying at those. Oh, Anat, can you go to the next slide? Sorry, I think someone's gonna have to drive during this. And so the county quickly bought up some buildings with the sole purpose of just social distancing for emergency shelters, and then I think realized, hold the phone, we have an incredible asset here. What if this is more of a permanent part of the solution to our housing crisis here? And so very quickly, Health Through Housing was created. Ultimately, it's going to be a portfolio of 15 or more housing sites throughout the county. Most of them are owned by the county, and then operation budget is provided to housing providers. 24/7 staffing services, as well as case management, behavioral services, medication assistance, with the goal of at least 1,600 housing units being provided ultimately. Right now we have about 11 sites that are open, serving about 1,100 residents, with at least 4 more sites coming online in 2025. And since 2023, Metro has been a partner with DCHS, who oversees all of these housing sites, to provide mobility services and solutions to these community members. Because while housing first is absolutely the right approach, a lot of these housing sites are in areas of the county that don't have great infrastructure, they don't have great access to fixed route transit. A lot of the individual residents have differing mobility capabilities, significant health concerns, limited technology opportunities for navigating the system, and oftentimes they're being relocated to an area that they're unfamiliar with, and so continuity of care, access to service, access to employment opportunities, continuing education, connecting to family, quality of life, et cetera, can be interrupted if the transportation components of that are not addressed. And so a big focus of what I did was around affordability, so getting transit passes to everyone who would use them, connecting with on-demand services, education and outreach. We have an incredible program called Community Transportation Navigators, which is a partnership with HopeLink, where HopeLink has hired a number of individuals with lived experience to be basically experts in all things transportation, trip planning, access to alternative services, utilizing an ORCA card, all of those wonderful resources that we have in our region for transportation that can kind of feel a little bit overwhelming on the surface. But we quickly also learned like the infrastructure around a lot of these housing sites is not great for navigating, both to get to transit, but also just to get to assets and resources within the community. And so together with Taskar, we sort of set out on this goal of, hey, can we maybe identify like where are the pedestrian access routes that have full accessibility, where are there gaps, and where are there opportunities for improvement, and how can King County and King County Metro potentially create solutions. Next slide, please. Oh, wait, actually back one. And so that is how we ideated on this pedestrian accessibility mapping project. So this is basically walk audits as well as satellite data of the half-mile walkshed radius of each housing site in this program. A lot of the data collection was completed by Taskar and involved going out and actually mapping out each sidewalk, each pathway, identifying where are there gaps, using their GoInfo game app to collect all that data and synthesize that in a way where they're able to identify, hey, here are where all the gaps are. If certain projects are completed, this is the amount of accessibility that is increased by this. Here are all the community assets within this area that are inaccessible by this portion of individuals. Here's how much more access to grocery stores, places of worship, transit centers, transit stops, et cetera, would happen if we increased the access routes in these specific areas. But the data isn't the full story, as we all know. There's like the storytelling that comes from individuals. And so the second component of this project was a series of 4 workshops that were completed at 4 unique housing sites within the Health Through Housing program that each sort of served like urban, ex-urban, unique areas within the entire Health Through Housing portfolio. Taskar led those and just collected like information about where people are trying to go, what areas are posing the most challenges. Is it lighting? Is it sidewalk quality? Is it curb cuts? Is it the width of the sidewalks? Is it the speed of traffic? Is it signage? There's so many different components to accessibility and safety and the sense of safety that is really important to get information exactly from the individuals that are living this day in and day out. And so those workshops really helped us tell a more complete story of like what the priorities are for these communities. The deliverables were a complete pathway data set with the data standards that have been set out. Project identification, which Taskar's really assisted us with, and it was also sort of based off of framework and guidance from King County Metro. And then the framework for expanding the use of a walk audit tool at Metro has been sort of the second component of this. We've seen we had incredible engagement from residents. I think kind of a lot more engagement than we might have expected for a series of 4 different workshops. But it really demonstrated to us that folks want to be able to go out and navigate their community and get to a grocery store and get to a transit center. And this is an important issue for them. And I would say that the biggest tangible outcome that has happened very quickly for us is that we identified that there used to be some temporary bus stops close to one of the housing locations that were removed after a capital project had been completed. And those temporary stops were less than a quarter mile away from that housing site. And once they were removed, the closest bus stop was over half a mile away. It was closer to 3/4 of a mile, which is just frankly not accessible for a lot of residents and was a feedback that we were receiving from the housing staff, from residents. Our navigators were fielding that. It came up in the workshops and was information that we were able to convey to other teams at Metro, and they looked at the route and said, yeah, there actually is a pretty big gap between these 2 different stops, and where those temporary stops are, it would make a lot of sense to add back. And so now that has been added to a work plan in 2025 and will result in much greater access to fixed route transit for this housing site, which typically those types of things don't occur this quickly. In partnership with this is our Connecting to Transit team. They manage a couple of different programs: parking management, so all of our park and rides within the county, mobility hubs, which is like how can we centralize all of these different mobility options, transit, micro mobility, bike parking, Ubers, Lyfts, et cetera, in one physical space where people can kind of convene and make different choices. And then safe routes to transit, which is improving access to transit, transportation safety, and transportation equity. And we had the opportunity to go out and use the GoInfo Go app that Taskar has developed and do one of the walk audits. And at that time, Connecting to Transit said, this is an incredible tool that Metro lacks and would really benefit from having the ability to go out and collect this pedestrian infrastructure data in a cohesive way where it's put into a database, stored, and is usable across all of our teams, because frankly there are a lot of different teams within Metro that would benefit from something like this. And with a little bit more configurability and with our, with bringing together internal stakeholders to think about how this data could be used, stored, and collected, like we could really benefit from having this and inform capital improvements, accessibility improvements, bring connected transit into that process in a different way. And so that's kind of a new phase of this project at Metro, which we're calling our digital walk audit tool. It's a continuation of the partnership with Taskar. Just a couple of the teams that have expressed interest in being stakeholders in this project are ADA Access Pathways, Transit Route Facilities, ADA Transition Team, Connecting to Transit, and Speed and Reliability. So that really shows you, like, all of these teams at times are out in the field needing this data, maybe collecting it, but haven't been sharing it or coordinating on the ways that we're doing this. And so this tool is really our opportunity to like develop something that works for all of these stakeholders, go out into the field and pilot it with the goal of long-term having a internal process and the resources needed to collect that data and use it to make educated decisions about where we're advocating for improvement projects in our capital portfolio. So some of the outcomes of this or objectives are just, an iterative internal stakeholder outreach. So bringing in as many different folks within Metro and being able to use this to advocate across many different teams and divisions. Also being able to improve the app. Like there are things that our teams would like to do that currently isn't supported by GoInfo Games, but is something that I think is of interest and a priority. So like new prompts, the ability to add quests. Sometimes I don't know how familiar everyone is with GoInfo Game in this room, but sometimes what you see on a map or on satellite data is very different when you're there in person. So the ability to change things or suggest changes in real time would be incredible. For us, it's a centralized database for storing this data, back-end cloud support. Like we're really gonna benefit from having all of this data in one place and providing access across all of these different teams. And then last one for me. The standardization of fieldwork is gonna be incredible for us. I'm much more in the like people-centered programming, so I'm not out doing this field work, but from what I've gathered in the process of creating this is we don't have standardized methods. We're doing it reactively, not proactively. We're not sharing this information across all of our teams because we're a gigantic agency that's doing a lot of incredible work, but there are so many folks that you may never communicate in your day-to-day life or day-to-day job, but are doing very convergent work. So this is an opportunity to standardize that, support and empower cross-team fieldwork data collection, have a singular place of shared data for all this data and information that we're collecting, coordinate better across capital improvements, like bring Connecting Transit and our ADA transition team better in at the opportune times and with data to back up the work that they're advocating for, and just actually to have a database of projects that we've identified. It's going to be a very big database of projects, and we're not going to get to all of them immediately, but being able to say, like, this is where we're going to have the best yield, it's going to improve access the most, it's the most lowest cost, easy to do. Those are all things that are going to be very beneficial to us. And that's it for me.
Everyone is done? Okay. All right. Next up are our wonderful Clara Cheeves and Grace Young from WashTalk. And let me get the right.
Okay.
Bring up
Hello,
there.
good afternoon, everyone. So that was really interesting. I want to talk with you and with some of you from Task Care Center about that tool because I'd love to learn more about it. So my name is Clara Cheeves. I work on the Sandy Williams Connecting Communities Grant Program, which is with the Washington State Department of Transportation under the Active Transportation Division. And Grace Young.
Hi, everyone. I'm Grace Young. I am the GIS and data specialist that supports Clara and the Sandy Williams Connecting Communities program and their data needs. I also support the Complete Streets program. That is not the focus of this presentation today, but that is a hat that I wear as well.
So if folks have questions about either of those things, we can do our best. We work on this grant program. So this is a statewide grant program that supports active transportation in communities on legacy and current state highways. And,
I don't know if it's advancing on the clicker.
oh,
It is.
okay. So I always like to start out with talking about Sandy Williams, who the program is named after. So Sandy Williams was a community activist and organizer from Spokane who worked to reconnect her community after Interstate 90. The construction of it cut her community in half, which was predominantly African American. And this program works to honor a lot of what she was working on before her death and address injustices that have occurred over the state highway system. Just a little bit of background about the program. It was created by the Washington State Legislature in 2022, so it's a relatively new program, and the program works, like I was saying, it's really focused on active transportation, which, just to translate that into regular language, is facilities for people who are walking, biking, rolling, using mobility devices along or across current or legacy state highways. And I just want to say, because I didn't define legacy state highways in this, but I just wanted to share legacy state highways. I think that when they were talking about the Bothell project, if people were here for that. So there are state highways that were built and created by the state, and sometimes through a specific process, they are turned back to a local jurisdiction. And so those are what we call legacy state highways. They're not just kind of like old highways. They're actually a specific designation that the state no longer owns. But the reason why we focus on them is because of the typology. So it's usually a roadway that's wide, that's fast, that has a lot of lanes, that doesn't have a lot of places to cross, and that was designed to move car traffic quickly, but to not move humans quickly or safely across it. So, and specifically, this program is focused on high equity needs communities, and we'll talk more about that as we go along. So, one of the things that I think has come up a little bit, but I wanted to emphasize, is that the program is guided by the HEAL Act, which is the state act, and is funded fully by the Climate Commitment Act. And so the HEAL Act, Healthy Environments for All, empowers and priorities recommendations from historically disinvested communities. That's how we, or how I kind of utilize the act for this program. And it's really focused on environmental justice and community engagement is how I am translating a lot of that into this work. So just a quick overview of the grant program. So a lot of times grants kind of focus on really specific things, and so as this grant was created by the legislature, there are some specific things that were identified to focus on. So this is how I'm kind of translating it, which is that this grant really is investing in people as opposed to investing in more spaces for automobiles. We're investing in human spaces, so any infrastructure that we're planning or designing puts people in place in the center of that design. We want to focus on community benefits, so projects do more than sometimes just build a sidewalk, there are other benefits that can come about. So not like that isn't incredibly important, but we can do even more with a project. We can make sure that we're addressing climate resilience, shade, maybe support local economic development, and making sure that people who are local can get hired for this work. So we really ask that the project thinks a little bit broadly about how it impacts the community that it is in. So safety, of course, incredibly fundamental, as well as comfort, which is something that always doesn't get talked about as much, but how we experience spaces is incredibly important, as well as the connectivity. So connecting not only to places that are important, like cultural spaces, medical centers, grocery stores, but also connections to each other. I think that the Mayor Carnation kind of touched on this, and as well as when we had our first Community Advisory Council, that was something that really was clear, and it's something that communities already know and understand, is that connection to each other is critically important, and these spaces really help facilitate that. And then the last one that is a big priority is meaningful community engagement. So this is something that I know Annette said we're doing the work. I'm actually kind of a middle person in this work. So we provide funding as a grant to communities, usually jurisdictions, to work on projects. So I am a little bit stepped back, but these are things that, these are what we really like to see projects embody. And so one of the things that is really crucial about this grant and a little unusual is that this grant really asks for partnerships with community-based organizations. And so that's something that we really look for. When jurisdictions are looking for funding is identifying those community-based organizations that can support and already have relationships with the spaces that you're working in. We've also heard a lot from the Community Advisory Council about culturally relevant and accessible opportunities for engagement. So thinking about how the engagement isn't just a repeat of something you've maybe already done, but is tailored to those communities and incredibly accessible in all the ways that something could be accessible. So time of day, location, amenities to support people being able to participate, food, so all of those things.
Wonderful. So Clara is really the policy mastermind behind all of this, but I get to support her on the data side. So when we joined WSDOT, they had put together this equity needs viewer, which talks about, one of the criteria for qualifying for this grant is that you are in a high equity need area. And of course, that can be defined in many ways. And there was some work done prior to our time at WSDOT to establish what they did an equity analysis using census data and various other data sources to determine these equity need places. And we inherited a web map, which is a tool that local jurisdictions can use to understand where the high equity need places in our state are. It also shows those legacy state highways, which are a little bit harder to know where they are. You might not know that one exists in your community. So we're putting it all on a map so that trying to provide the data to the local jurisdictions in one place so that they don't have to go to a lot of effort to determine, do I qualify for this grant? We want them to be able to go to one place and get all of the information that they need to see, okay, based on the criteria of this grant, we are a local jurisdiction where it's worth our time, worth our resources to apply because we fit the criteria. We want to make it really easy for people to know that that is the case. So some of the things, this map currently, the screenshot that it's showing shows the high equity need score that is calculated based off of a subset of equity factors. So this is the equity need viewer. It is a website. It's linked on our Sandy Williams Connecting Communities WSDOT page. And it's an interactive map. You can zoom in and see the conditions in your community, the legacy state highways, the current state highways. It also includes information summarized to the census block group level about pedestrian and bicycle collisions, history on state routes in your community, as well as additional detail on race and ethnicity, as well as languages spoken, which could be a resource for people conducting community engagement to quickly see, okay, what are the other non-English languages that are present in our community that we might need to provide non-English language translation for in our community outreach. And then it also identifies tribal lands who are a very important partner in this work. But the equity need component itself has 5 components underneath it that all contribute to, what it means when we say high equity needs. So transportation, we know, is very important to how you get around, and certain places have higher transportation costs associated with them. Maybe it's a very rural area where your only choice is to drive, but gas is expensive, and maintaining a car is expensive. Or there's places where there are a lot of people who don't have access to a vehicle. Those people have transportation burdens in different ways, but still is an equity need. Then we're looking at health. We've mentioned the HEAL Act, the Healthy Environment for All. So health has to do with your personal health, but also the environmental health around you, which connects to the environmental justice as well. We're looking at economics, so household incomes, low-income locations, as well as family and community. The youth and seniors are particularly vulnerable users, as well as, we want to look at the ethnicities, the races and ethnicities in those areas to make sure that we're righting some historic wrongs that we have committed, and just generally understanding the populations of these communities. But what I wanted to talk about next is I am a data specialist, and I understand the powerful impact of data. And I think there was somebody from King County Metro here yesterday who mentioned being values-driven but data-informed, and I really like that quote, because I think there are some things like sidewalk data which are very objective. There's either a sidewalk there or there's not. But a lot of demographic data can be very, if we rely on it being so objective, we might miss things about the community that are really important, and it's really hard to summarize an entire community into a census block group, which is just arbitrary lines that are drawn on a map, and you're counting people, maybe not even accurately, because maybe people weren't home the day that the census count went out. There are a lot of reasons why that data might not tell the full story of a community. And so, yes, this equity index, want to acknowledge, it was built on a lot of census data, and it does draw those hard lines, because a lot of times the way that legislation is written is, some percentage of the funds must be given to high equity need communities. And that creates a very much, you're either in the map or you're out on the map. And if you're in on the map, therefore, great, you're probably going to qualify for funding. But maybe your community across the street is functionally the same, but because of the way that lines are drawn on the map, you're out, where across the street maybe you're in. So I just wanted to raise the point that relying on data too heavily is a problem, especially when we're looking at some more subjective data like demographic data, and raise a conversation that we don't want to just rely so blindly on this, and this is why community engagement is so important, and the people who are applying for these grants really demonstrating that they understand their community needs, and they're not just saying, okay, well, our score on the map is a 12, so therefore we are high equity needs. Okay, well, what are the actual needs of that community? Just saying that it's a high need doesn't actually tell the full story. And so really Clara is excellent at this, and working with the community to get them to understand, like, what actually are those needs when you're applying for our grants and when you're asking for money. Like, demonstrate that you have done the work to understand what those needs are, because we can produce a map that with numbers, which is, like the HEAL Act relies on overburdened communities, which is also based on census demographics. And that is, that's how our funding is measured. Are we meeting this funding commitment or are we not? But you have to look a little bit deeper than that and not just be so blind and say the data says so, so therefore it is true, and really, think and expand that to a real person connection.
So kind of final slide. So just thinking about what's next. So one of the things that I've been thinking about a lot when we were preparing for this is thinking about something that I've just recently learned about called a data ecosystem that really diversifies the type of data sources that inform the work. And so we are looking to convene a community advisory council this year for the active transportation division, and it will be bringing community members from around the state together. And one of the things we do want to look at and talk about is incorporating community knowledge and ownership of data and what that looks like. And so I think that's why some of the tools that we're learning about today that are already being utilized are really great to hear about as potential. And then, of course, Senator Nobles, who was really instrumental in ensuring that this grant continues into the future. So if anyone has any questions.
Thank you so much. This is inspiring work.
Good afternoon, everyone. My name is Cameron Steinbach. I'm the Climate Justice Program Manager with Front and Centered. For those of you who are not familiar with the organization, we are a organization focused on statewide policy, focused on climate and environmental justice. We're made up of organizations across the state, led by and serving frontline communities, primarily Black, Indigenous, and people of color organizations. I'm really honored to be as part of this panel and to be a representative front and center in our work. I've been with the organization for about 10 months, and I have the responsibility and the privilege to carry on work that was started before I joined the organization, and it's really important, and there's a responsibility to hold. I see Paulo here in the room, the person I spoke to this last summer, who you'll recognize much of the work that was led and organized by him and many other folks who came together for what is our primary policy framework in transportation. I'm gonna make sure I have my notes here set up. So in terms of what we are interested in and focused on, what we built, thank you, for transportation justice from Front and Centered for the state of Washington is a just transition. And those particular policy standpoints that we have are ensuring that we have consistent investments for safe sidewalks for all the ways of active transportation, focusing our advocacy efforts at the state level towards ensuring that the budget supports climate and mobility justice, that we have clear and actionable standards for complete sidewalks and public transportations, and of course a moratorium and divestment from highway expansion in frontline communities. And these are points in which I'm consistently communicating what climate justice means to Front and Center, and what does it translate to in this transition, a just transition for transportation here in the state of Washington. I often identify and talk about the ambitious plans we have for greenhouse gas reduction, and combining that with what are the key ways in which we make these changes and make sure those changes are done equitably across the state, so that our communities that are first and worst hit by climate change have the resources to adjust to that change, have the participatory structures so that their needs and their priorities are represented in the funds and resources that are going to the investments and the changes that we need to make for our communities, but also that we have the kind of things in place so that our communities, from those organizations to those individuals representing the diverse communities, whether it's here in King County, in Spokane, or in the Tri-Cities, that you have the tools to articulate what is your community's impact, what are the community's needs, and of course, how we develop the leaders to continue and do that work. So I'm speaking about the work we've set up that has brought us to where we are now. One of those things that I consider when we're taking in those points of input from our community, we have a transportation justice focused work group where we actively and continuously listen and engage with our community members on our coalition to identify those needs, those priorities, those issues that are coming up, and how we crystallize that into a strategy that we can see real change at the state level. And we've built a fantastic framework to do that. What we look for it in the future are what are those tools that have helped our community leaders, have helped those community organizations articulate and act on those needs. And as has been described throughout this entire gathering is all these fantastic data tools. I'm really excited and encouraged to incorporate more of those and build those out into the advocacy tools for community organizations so they tell those stories, so they use the data that is pertinent to the intersectional issues that they're experiencing that are related to not just transportation access and mobility, but the safety that they feel and experience, whether they're riding public transit, whether they're going from their home to their place of worship or to their school, to their understanding of the networks they have access to. We have many organizations that are working with new residents to the state, new residents to this country. So there's many different ways in which we know that our communities want to address the challenges they're experiencing. So I'll speak to real briefly one of those tools that I find is very impactful and influential from when it was created is the Washington Transit Access Map. This is one of those tools that was focused on frequent and reliable transit access and how those disparities are showing up across our communities across the state. So using, of course, public transportation information, how many communities have access to reliable and fast 15-minute headways for their transportation infrastructure. So it's a way for to illustrate where those disparities exist within a county, across the city, and of course we can use this tool to articulate and describe these challenges across the state. As any good tool does, you can incorporate other points of data from density that's happening, from the particular kind of environmental impacts that are concentrated in certain communities. So there's actual toggles through this map where you can look at, of course, the density of an area, population density. You can look at the rates of asthma. These are lessons and tools learned from the implementation of the Environmental Health Disparities Map. What I would like to see this work doing going forward is incorporating more of the points of data and information from sidewalks to safety to different crossings that exist in communities so that we continue to have a clear way for those communities to articulate their needs and strategize for those processes in which we go to our state legislatures, to go to our city councils, to go to our county councils and speak to the particular needs and have the knowledge and equipment to engage with the different transportation agencies we have across the state. So I believe it's a very valuable tool that has served one advocacy purpose, and I am interested in continuing to evolve it to speak to more of those points of data that our community wants to have access to and how they continue to craft that narrative and that story for the things that they want to see changed for their transportation needs. And I'll speak to one more thing, and then we can turn it over to some of the question and answer from all of our panelists. That this work has translated into us working with WSDOT. I believe a couple of years ago, WSDOT came into a pool of money that we wanted to direct towards community-led transportation projects. So in the past year and a half or so, Front and Center has been working with the team at WSDOT to deliver grant monies, grant funds, focused on curbing and reducing pollution. And we're able to actually infuse and give transportation justice lens throughout this grant program. Right now we have about 20 different community-based organizations who have been granted funds to lead transportation projects in their communities. These projects range in variation and diversity from installing EV chargers in particular communities to getting bus passes and funds for folks to use transit, to educational programs for new communities to understand the infrastructure they have at their disposal. And one of those goals is, of course, reducing the burdens for community-based organizations to do this kind of work, which is the value for us for that community-led and community-formed participatory structures, reducing the reporting burden on them, to ensure that they are developing as leaders and identifying the continued issues and ways in which they want to continue to develop those plans for a just transition in transportation for these organizations. And of course, these organizations are not exclusive to the Front and Center Coalition, but it's something that we are proud and privileged to be leading with partners in the state government to build frontline community leadership for the kind of transportation change and transportation justice that we want to have. that's a quick highlight on some of the things that we're able to do and proud to do and continue to do as Front and Centered as an organization, as a coalition, and is continue to build out really strong tools for our frontline communities to advocate for the changes and the resources that they want and need for transportation justice.
Thank you. I'm so glad each of you were able to both address the question, but from very, very different angles. I love that. Are there any questions from the audience? Oh, I thought I saw a hand. Yes. Someone can.
Hello, thanks for your presentations. I'm a community organizer at Disability Rights Washington, and I not mentioned our story mapping project yesterday. I'm like very weary of, we collect all these stories. We've had stories from people across the state. We've done housing surveys. We're in the middle of starting a new story collection project on land use mapping, and we don't have, we get I think the story mapping project, we had 170 people participate. I'm not sure the last housing survey we did, we don't have enough responses to have a statistically significant data to share. And so I'm always weary of even thinking about it as data. But when Grace started talking, I was thinking about if you we're always how do we present this in a way? I know our stories are powerful and we use them all the time, but presenting all of this together, and it was just one of you had ideas of how do we present these in a way that's that can be easily tied into all of your data points to expand what Grace was talking about.
Sure if this is exactly what you were thinking, but one thing that I've been hearing in different spaces when people are talking about data is also, we didn't touch on it, but the qualitative data, right, that you're talking about, and then the quantitative data, and making sure that they're held and respected equally. And I've also seen a couple of these types of I guess maps or viewers where we have some of this quantitative data laid out, but there's also the stories that are linked to place. So you could go and click on that location where that story could pop up. And I've seen that. I think Berkeley, they have some sort of transportation center where they've done it. Do you know what I'm talking about? Okay. And so it's a really interesting thing. So you can go and that's more related to places where people wanted to share, maybe specific things about infrastructure, but I've seen it related more to climate. And that's something that I was thinking. So Sam, we didn't talk about it, but Sandy Williams, Connecting Communities Grant Program also has a story map that's really right now only telling where projects are located. But I think that right now it's a really underutilized tool, right? And so I think bringing in actual stories, a story map, and putting it on there, I think would be great. And so if you want to talk more, I'd love to do that.
Is this on? Hi, Leah Figueroa, King County Metro. I am Latina, first-generation American, and this is kind of pertinent to the question. I have birthright citizenship, and I have been hesitant to fill out information now because of that, with what's going on. How are you reaching to people who may not be documented, especially in areas of greatest need? How are there plans to gather this data? Because they're not going to fill out paperwork. Growing up, even though my dad was here legally and was not a citizen until I was well into my 30s, he was hesitant to fill out paperwork because of some of the issues with being an resident alien in the States. Now the political climate is such that it's a lot harder. So as we move forward in these projects, how are you going to get those people?
Yeah, I can speak to that a little bit in the implementation or the development and preparation for the grant program that we're currently running. one of our key conversations was around data sovereignty, right? How are we empowering and giving our participants the agency to ask the questions that are pertinent and important to their community? And I think that's one of the benefits of having the kind of relationship with an organization like Front and Centered, or it could be any organization, and a partnership with WashDOT to allow the community to self-determine how they're going to answer the questions, what kind of data about their participants they're going to collect, and saying like, and having that firewall saying like, this is the information story you want to tell, and you get to control how you are or identifying the participants in that, but trusting that the community is saying, these are our people, this is what we are wanting to see, and this is how we want to navigate and lead the change or the implementation of this project. So that's one of the things that we identified and discussed and purposely put into how we're talking about and leading our cohort and our organization. So one of the outcomes that we will report on, because we're going to do a report just coming up next month, and a final report is speaking specifically to that purpose and power of why it's important to have the community-led projects, the community-led implementation, and giving those funds directly to community so they can self-determine how that's used and implemented, so that we can address or not so much avoid, but get beyond the kind of things that make this such a perilous environment and speak to, this is the issue, this is a transportation thing, these are who's responsible, and how are we making the change. And hopefully as we see that transition, that we have more of our community leaders speaking to and leading that change versus having to give over our data to say why we need a project to happen. We're saying, this is a project we've designed, this is the impact we believe it's going to have for our mobility, for our justice issues, and it's going to help reduce our greenhouse gas emissions, right? And those kind of arguments. Yeah.
I am not a community engagement specialist, but I just wanted to say that's a really great point that you raised. And I do think definitely like when the state is coming in, state equals government equals, maybe that's something that people are fearful of right now. And so I do think that that is a huge benefit of having these community-based organizations leading the work, is they're more frequently in the community and they're known people. And it's not like, ooh, the state is coming in and, I don't want to share this information with them, because who knows who they know and who they might share this information with. So having people who are known players in the community and trusted community individuals, I think that's really important for getting that community engagement piece.
I am an advocate from last 15 years in Seattle, here in Washington State, and been an organizer, educator, and researcher. So I'm engaged with transportation choices, fighting for all those bills that are in trouble, right? So I would like to talk about the Climate Commitment Act. How can we protect the budget funding for the Climate Commitment Act at this time? Because I know, talking to the reps and the senators and, writing them or finally talking with them, we are already doing that. Apart from that, what else you suggest us to do? Because we don't want the funding to go. We want the full funding,
I'm so sorry. I don't think we fully understood the question. So we want full funding?
No, Climate Commitment Act, in that they are taking away some of the fundings. And we don't want, the Biden has already given the full funding. We want the same funding because it's not enough to work in different projects and work. So they are not giving the full funding at the moment. So what action you guys are taking in this advocacy?
Well, I think the folks on the panel are not legislators, so
No.
we're
They're
doing.
for advocates. I'm
I
an
see.
advocate.
Thank you
another
for
advocate.
clarifying.
Yeah.
I can speak to a little bit of it, but it is not currently my depth of work at Front and Centered right now. But in terms of the key question is, how can we, as advocates, protect the kind of investments that come from the Climate Commitment Act And it is, a resource that we have at Friend Center is a dedicated couple of staff persons that focus on the budget and go through and do that deep analysis of where the budget is being stated from the Senate, the House, and have contacts with the governor's office to have those points of contact, to have that analysis done and published and shared for all of our different community advocates to highlight and pinpoint where those things are, slated for cuts, so we can strategically go to our representatives and have that clear messaging that this is a resource that is needed, and these are all of the people that are behind it. So the work that TCC does, the work that we are continuing to do with our budget analysis and having that be a ready-to-go resource as quickly as we can, those are the actions that we're able to take.
I mean, we are taking those actions, but I just wanted to, if anything new that you guys are doing that I don't know, then I might jump on that. But we are all already doing all these things, contacting the senator or contacting the reps and pressuring them. But since we are, the Republicans are more in numbers, so they are not letting it happen. They are winning. They're doing whatever they want. So I was asking if you have any tricks so that we can go forward. Well, thank you though.
Yeah.
So I think we'll take that as a tips and tricks.
Yes.
Last question for maybe for everyone. As we end this session, what are some takeaways you would like the audience to go with as far as like top priorities, tips, and tricks
Yes.
going forward, given the current political climate?
Great question, Anat. I'm not an advocate and not a legislator, so probably have to choose my words a little bit wisely here. What I would say is one, I would suggest everyone protect their own well-being in this process. It's I know it's an extremely challenging and concerning time on a multitude of fronts, and so finding opportunities to advocate for your rights and your needs and the well-being of the community members and communities and cities, counties, states that we care about, while also recognizing that change is gradual and that the pendulum tends to swing in both directions over time, and not making space to still be yourself and heal and not get completely bogged down in just the news cycle. I'll pause there.
So I guess my question was, within the constructs of your programs, are there ways that the population can contribute to the good work that you're doing in ways that are helpful and empowering?
Revise my answer. Yeah. So, within my program, and I would say beyond it, it's really this intersection of housing and transportation, and recognizing that they really go hand in hand. And so, as a transit agency working with housing providers and community-based organizations, nonprofits that are serving folks that are experiencing chronic homelessness, and understanding yes, housing comes first, but where people are housed and how they can get from their housing location to services, to healthcare, to visiting family, job opportunities, et cetera, is really important. And that doing one or the other can have some downstream impacts that we'll need to address later. And so cohesively planning around transit-oriented development for new affordable housing, thinking about how our service changes specifically impact this incredibly vulnerable community, thinking about ways that evolving technology can support things like on-demand service through paratransit, et cetera. All of those elements I think are really important as we kind of consider this, overarching issue across our region, which is housing.
All right, I'll say for this program, I would emphasize partnerships and coming together. I think this experience has been really, really beneficial. I think that some of the partnership we've been able to, or at least getting a chance to work with Front and Centered, which has been really, really wonderful. And I've been learning a lot from that experience. And I think kind of going back to the program and the foundation of the program, which is about we're not just going out this alone. You're reaching out, you're working with a community-based organization, with what the mayor was saying about just go and talk with people and build those relationships, because everybody will be better informed and things will be improved because of it.
Well, Clara is the Sandy Williams Connecting Communities expert, so I would ditto what she said. And I'll speak a little bit from a data perspective. I think sometimes data and like developing data indices kind of happen after the fact. Like, okay, we've decided the Sandy Williams Connecting Community program is going to happen, and then it's going to be in a high equity needs area. But then, there's a next step of defining what those high equity need areas are. And maybe sometimes that's a less flashy area to provide public input on, or maybe it's, sort of a black box. And if there are situations where you don't understand how something is happening or how an indice is being developed, like really ask questions and force people who are using data to make decisions about your lives to like explain to you how they're doing it. It shouldn't just be some magical shrouded process that then decides the future of the funding. Really ask those questions if you don't understand, or even if you do understand and you think it's wrong, ask questions of them and make them tell you how it is working. I think that transparency is really important.
Yeah, I agree with everything that's been shared. I'll just add to the what folks can do. And it's building off of what we believe is going to really result in the societal shifts, the just transition shifts that we want to have that arrives at true community ownership and community leadership. And that starts now with the leadership development. That starts with continue to trust communities, trusting community organizations to determine and to lead their projects that they want to have, and considering all of the intersectional ways in which not just our data tools are speaking, not just as policymakers, but how they're speaking to those community members that are wanting to articulate what's happening, not just to the decision makers, but articulating across that community so that their stories are well represented and told. And lastly, that development is with youth. I'm a lifelong educator, and the more that we look at these intersectional pathways and include our young people in building these decision makers to either join state and local agencies or to lead transportation projects from the community perspective, those are the shifts and changes that I'm working for.
Thank you. I think I'll add one thing in a minute, just because of our partnership that Nick was talking about. When we came into the Health Through Housing project and wanting to survey folks who are living in these transitional facilities in various temporary, non-stationary situations, I felt not equipped to work with the community because we haven't had that prior experience. And so partnering not just with King County Metro, but their own partners in HopeLink's CTNs, which Nick was describing, was so crucial to the success of penetrating the community, establishing trust, being able to speak to folks. I mean, by the end of the project, we spoke with 140 people who are whether transient or non-temporary residents in these residencies. And I don't think we would have been able to do that at all had it not been for HopeLink's CTN network and the people that were able to, introduce us to the community. So I think maybe my lesson is learn or know your limits and be able to partner across to bridge to the local community in the ways that they find accessible and trustworthy. I think that's what you were speaking to in some ways, but that was really our experience with that. So thank you to all of you. I really appreciate the work that you're doing.